I want to introduce Dr. Mattson from the Minnesota Medical Association.
Thank you, and good morning. My name is Dr. Lisa Mattson, and I'm the current president of the Minnesota Medical Association, an organization that represents over 10,000 physicians in Minnesota. As president, I personally have been made aware of the presence of ICE agents in our hospitals. I had a report of a detainee in the ED with injuries inconsistent with accidents. I also had a report of a vulnerable adult who didn't have a caregiver with him to help him make important medical decisions. There are reports of ICE agents refusing to leave the room for private exams or while patients are getting bed baths. There are also reports of staff experiencing rude and harassing behavior from ICE agents. Their mere presence in the emergency departments make a difficult job even more stressful for all the staff, thus interfering with patient care. We also know that people are not going to their regularly scheduled doctor's appointments, as was mentioned. This is adults as well. They're not leaving their homes for work or school. They're not picking up their prescriptions or getting their vaccinations. And they're not obtaining healthy food for fear of being detained by ICE. This means that acute and chronic illnesses are not being managed properly, and it increases the likelihood that these individuals will end up seeking emergency care. Preventive care is always better and cheaper than waiting for an emergency to arise. We're also concerned about the indiscriminate detention of anyone with brown skin, including Native Americans, who are the only people among us who are not immigrants. A report by one of the local news agencies last week reported that only 5% of detainees in Minnesota have a history of violent crime. And in the worst of the worst, 7 of those people's only crime was a DUI. Under EMTALA, the Emergency Medical Treatment and Active Labor Act, which was codified in 1986 under President Reagan, all physicians are required to provide emergency care for any patient, regardless of citizenship, legal status, or ability to pay. We also swore an oath to take care of all of our patients with unbiased, respectful, and dignified care. The MMA wants to ensure that all Minnesotans, regardless of immigration status, have access to safe and timely and high-quality medical care, and that ICE enforcement actions do not interfere with that care and undermine the health of our communities. Thank you. I'm going to pass this over to Dr. Stevens.
Thank you all so much for being here. My name is Dr. Erin Stevens. I'm the legislative chair for the Minnesota section of the American College of Obstetricians and Gynecologists, otherwise known as ACOG. As stated in our committee statement, Healthcare for Immigrants, released by ACOG's Committee on Advanced Equity in Obstetric and Gynecologic Healthcare, the American College of Obstetricians and Gynecologists supports the health and well-being of all who seek obstetric and gynecologic care and advocates to secure quality healthcare for all without regard to immigration status. Policies that infringe on the health and rights of immigrants and limit access to health care, anti-immigrant rhetoric, and punitive immigration enforcement activities all have detrimental effects on health. In my personal experience and that of many of my colleagues providing care in our state, we are deeply troubled by what we have seen. Before this surge of activity even began, I was on shift at my hospital walking outside our emergency room entrance, which is prominent, the first thing you see as you drive up to the hospital. And just outside the ambulance bay in an area meant for patient pickup and drop-off, I witnessed multiple unmarked vehicles with tinted windows park in that area. They were stationed there for quite some time, with agents going in and out of the hospital doors. I was immediately concerned for my patient's safety and privacy, and I cannot imagine how patients felt seeing the same activity, particularly the patient population we serve who are immigrants or could potentially be subject to racial profiling. Immigration official presence has, of course, significantly increased in our state since that time. Last week, ICE agents accompanied a patient into the emergency room of our hospital, worrying other patients and care providers alike by their presence and uncertain levels of access. The presence of these agents at points of clinical care intimidates patients, threatens their privacy, and obstructs access to care. Many of our patients, undocumented immigrants, naturalized citizens, and U.S.-born citizens alike, fear leaving their homes for access to health care. They express to us a feeling of being hunted. Our patients are missing, canceling, or deferring important appointments for prenatal care out of fear of being targeted by immigration officials in their place of care. Anecdotally, many of our labor and delivery triage units are seeing lower volumes as a sign that individuals are not seeking out care with urgent concerns. Requests for resources for home births are up significantly, even among patients who had never previously considered this or for who it is not a safe option, and that is probably the most common thing I am seeing discussed amongst healthcare professionals. Some are birthing in the hospital alone, with no family, friends, or personal support present due to detainment or fear thereof. Patients presenting to outlying hospitals in greater Minnesota with serious conditions are refusing transfer to the metro area for higher level of care. The impact of intimidation and profiling on patient care and outcomes is real and may perpetuate already existing disparities in healthcare. We want to assure our local communities that individual providers, clinic groups, and hospitals are working to increase home health visits, mobile visits, and telehealth care, while also solidifying and strengthening on-site protocols to address our patients' needs in a safe manner. Our community is rising to meet the needs of our neighbors. As OBGYNs caring for those in our community, we affirm our commitment to the compassionate care of all of our patients without regard to their immigration status and oppose activity that restricts or obstructs that care. I will now turn it over to Dr. Dwevetti from the Minnesota Academy of Family Physicians.
Thank you. Good morning. Thank you for the opportunity to speak. I'm Dr. Rolly Dwevetti, a family physician and the immediate past president of the Minnesota Academy of Family Physicians. I'm here today on behalf of the MAFP that represent more than 3,100 family physicians, residents, and medical students across the state of Minnesota. We provide care to all Minnesotans. Today, alongside with my colleagues from other specialties, we reaffirm our shared commitment to safe, equitable access to care for every Minnesotan and raise our concerns about current immigration enforcement impeding that access and spreading fear across Minnesota. No patient should ever hesitate to seek care because they worry about their safety or the consequences of walking into a healthcare facility. I have been a practicing physician for more than 19 years here in Minnesota, and I have never seen this level of chaos and fear in the healthcare for patients and for our healthcare teams. It is tragic and is unthinkable. It is more challenging than the acute part of the pandemic in many ways. I want to share the reality of what physicians, nurses, other specialists, therapists, pharmacists, students, and our state future workforce across Minnesota are seeing right now. These are not just missed opportunities or appointments. These are life and death crises. There is trauma and moral injury. Last week, a patient with kidney cancer vanished from his scheduled visit. When his clinician called, they found he had been detained and moved to Texas without his medications. While legal intervention eventually got his medication to him, we still don't know if he is actually taking his medications. No one deserves to die or suffer because of how they look or how they speak or where they were born. In another case, a patient with insulin-dependent diabetes stopped coming to the clinic. We discovered they were not just not out of medicine, but they were out of food. They were rationing both the insulin and their meals without knowing how to adjust insulin. We are seeing levels of food insecurity that are simply horrific. A pregnant mother missed her checkup and stopped answering her phone. A nurse went to her home and found her 8 centimeters dilated. Laboring alone and terrified to seek help. She delivered just 2 hours after the nurse finally convinced her it was safe to go to the hospital. The cycle of fear is claiming lives. Recently, a patient discharged from the hospital missed their follow-up because they were too afraid to leave the home. What should have been a routine wound care appointment turned into a life-threatening case of sepsis. A simple office visit would have solved them from returning to the ICU, and we know our ICUs are already filled. The trauma we are witnessing is horrific. In our clinic parking lot, a mother and a son were forcefully separated from while trying to fill a prescription for a seizure medication. The trauma triggered a medical crisis. The son was rushed to the hospital in the midst of a seizure, while his mother was sent to a detention center in Texas. In Wilmer, Minnesota, fear is paralyzing the community. Families with legal status are sleeping in trucks to avoid home raids, choosing the cold and illness over the risk of suppression. One teenager nearly collapsed from starvation, surviving on a single egg in 3 days after her entire family was detained. Our places of healing are under siege. I was notified that a clinic was surrounded by masked, armed individuals and orange buses with blacked out windows. When a clinic like this is treated like a tactical zone, who would feel safe enough to go to the healthcare facilities? Dental appointments have dropped in half. Several clinics have reported no-show and cancellation as high as 60%. We know from the pandemic the consequences of postponed medical and dental care. In primary care, we see firsthand that when people delay or avoid care, the harm compounds. Chronic conditions worsen, injuries go untreated, preventable complications grow more serious. Our patients and communities are scared. I have dozens of other stories to share, but the bottom line is this making America healthy again? I stand here with others representing healthcare providers across Minnesota, pleading on behalf of our patients and communities and our staff. Healthcare is a fundamental human right. Our communities deserve to be safe and healthy, but right now we are failing to meet the promise. It's time we immediately change our course. Thank you. And with that, I will invite Senator Mann.
Thank you, everyone, for being here today. I'm Senator Elise Mann, Senate District 50, and I am a family medicine and ER physician. You've heard stories today about ICE agents inside of our hospitals, ICE agents walking into patient rooms without warrants, ICE agents setting up shop outside the emergency room doors, ICE agents waiting at clinics to separate families as they walk in to get their medications refilled. At no time, the only other time in history I can remember having a group of physicians standing in front of you was during COVID. Because you have any idea how hard it is to get doctors from across the state and across all specialties to join together. This is a moment of crisis in this state because of ICE and their presence in our healthcare settings. You have a group of people in front of you today who have sworn to take an oath, have taken an oath that to do what's best for and to take care of our patients. The presence of ICE officers in our hospitals is preventing doctors from doing that. Again, you've heard the firsthand stories about how ICE is acting illegally and unconstitutionally. They are acting unlawfully and in turn are jeopardizing patient care and the health of our patients. This is not making our city safer. It is about harming entire communities, making certain that certain communities feel afraid to go out, to get groceries, to go to school, to go to work, and now are afraid to get medical care. We are here today because we want the rest of the country to know about what is happening inside Minnesota hospitals and inside of our clinics, because it will happen in your state also if it hasn't already. And lastly, we want the world to know that not only will the people of Minnesota stand in solidarity with each other and protect one another, but Minnesota doctors will stand in solidarity and we will protect our patients.